Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Wohler, talking with experts in functional and integrative health and medicine, discussing critical information for improving your health and wellness to help you live a long, full life. Let's get to it. Hi, welcome to the Functional Medicine Doc Talk podcast. I am your host, Dr. Kurt Wohler, and I am joined today by Terri Hirning. We have a lot to discuss because Terri and I actually have a history that goes back a number of years, which we'll get into. And Terri is a mom of a son who is now recovered from autism, who's currently in college, and actually just received his Eagle Scout in Boy Scout a couple of years ago, which is highly impressive. So we're going to talk about that. We're going to talk about her journey. She also does a lot of work in health intervention with regards to integrative and functional medicine health. So all of that we're going to get into here. So Terri, welcome to the program.
Thank you so much for having me. It's always great to sit down and talk with you.
So you have interviewed me in the past, and I wanted to interview you with regards to your journey for Matthew and how things came about, as a mom of an autistic child who is now a young adult. There's obviously a lot of history there, a lot of things we'll get into, and we can expand on that. And we also want to talk about some of the other projects you're working with. So let's go ahead and dive in. So, take us back to sort of the beginning of how things evolved for Matthew and in this autism journey.
Yeah, so it was, it's been a wild ride to sum it up. Matthew was a very sick little boy. He reacted to a lot of things. He started reacting to childhood vaccinations and became inconsolable even as an infant, and really had issues with constipation. He would scream most of the day and night. And then as a toddler, he began really losing eye contact. He would not make eye contact with me. He was giggling in the middle of the night for no reason and alternating between screaming and giggling. He wouldn't respond to his name. He would become very fixated on things and was very hard to redirect. He did not sleep, which of course then meant we didn't sleep. And when we finally got a diagnosis of autism, he was 4, almost 5, and we had been referred to our early intervention system in our state, and he was in a preschool for children with autism, despite not actually getting that diagnosis for another couple of years. So when we got that diagnosis, he had all of these physical or biomedical issues, right? Constipation, a bloated belly, red circles and rings under his eyes. He would, melt down over sensory stimulation. He couldn't sleep, all of those physical things. But when we got a diagnosis of autism, it really was just lumped together. And what we were told at that time was, he has autism, and he was actually labeled with severe autism back then. And we were really encouraged to look at long-term care for him. We were told he was going to have to find a group home for him to live in, that he would never live independently. And so, my husband, Eric, and I, we were sitting there really dumbfounded and not really understanding what this was going to mean for our future. But I remember thinking, this can't be his reality. I didn't know how, I didn't know, where I would go, but I knew that wasn't going to be my son's story.
So let me go back a little bit. So it's interesting that he got a diagnosis so late. And at what time frame did he regress? And you mentioned that he reacted quite negatively to some earlier immunizations. Do you remember any specifics, around the time frame of what shots he got and what time frame you started to see? Yeah.
Absolutely. I had one of those calendars that they send a lot of the new moms, right? Like the little Nestle, formula calendar, and it's got all the stickers, because I was one of those super type A moms, right? So Matthew was born on September 9th. So for the 2-month shots, we were in on November 9th. If that fell on a Saturday, we were in on the Monday. So that was the type of parent I was. So it's very easy for me to go back, or it was very easy for me to go back and look at what transpired. So it was actually his 4-month vaccinations, and he received 7 that day. So I went back and I opened up his shot record. That was not a catch up. We were on schedule. That was his normal routine schedule. And so I don't know whether it was DTaP or, polio, which of the 7, because it was 7 vaccines. And I remember very clearly the doctor saying, well, it's 3 pokes, but 7 vaccines. And so, it was all this combination. And then, of course, we were encouraged to give Tylenol after, because it was that day I took home a baby that would not stop screaming. And
Did he get quite feverish afterwards, or was he just preloaded with Tylenol or afterwards so he didn't develop fever?
we didn't preload him, but Matthew was a kiddo who didn't run fevers. So
Okay.
this was before meeting with you, because by 6 months of age, Matthew had chickenpox. And they made me come in several times to make sure that the diagnosis was accurate, because they didn't see chickenpox in 6-month-olds routinely. And so then again, he got it at 3 years of age. Both of those times he got chickenpox, he did not run a fever. And then when I was working with you, there was a test out that looked at immune competency, if you will. They've since taken it off the market, but we were able to gauge his natural killer cell activity. And I remember looking at those results, and it was almost as if he had no natural killer cell activity. So his poor little immune system had all but given up, and
Well,
I think
it's interesting. Natural killer cells, Terry, as you know, are part of the immune system that's very helpful against viral infections. So continue.
and it was one of those things where, if we don't right this ship, what's going to happen to this child? His immune system is completely dysregulated. And it would be interesting, because on the few occasions where he would run a fever, his autism symptoms seem to get slightly better. So what do I mean by that? Like better eye contact, more responsiveness, because otherwise he was very much in his own little world. And it was like a switch that got flipped. So I took him into that appointment. And when I took him home, we couldn't do anything to console him. I would wear him in a baby sling. I had to vacuum. When I would vacuum, that seemed to help regulate his nervous system, and he would stop screaming, and he would finally be able to go to sleep. And I would lay him down in his crib, literally still in the baby sling, and slip out of it, get a few feet out of his room, and he would be crying again. And we'd have to start the whole thing over. And that was how life was 24/7, not just at night, all day, all night. And we would kind of get him leveled off. And then it would be another round of vaccines. And we would literally start all over again. And the answer that I got was, oh, it's colic. This is natural. Now he's 6 months, and this is just what happens to some babies, and it can be gas, or it can be this. Give him, the anti-gas drops, give him Tylenol. Oh, now he's teething probably. That's probably what it is. Give him Tylenol. And of course, now here we are, how many decades later, and all this about Tylenol and the role that it plays in, reducing glutathione production and even implications in autism. So, now we know, then we didn't. But I was just a mom who was exhausted, worried, stressed out about why my baby can't poop without a laxative, why he can't sleep, why I can't console him. And then by 6 months, he stopped looking into my eyes, and he started looking at my hairline. And I remember that very distinctly. It was just a really interesting shift. And then he would just get farther and farther away from us. He just stopped responding, So it wasn't like we had a child who was speaking or who was walking and then had a dramatic regression, it happened so early that he didn't meet those milestones. He just didn't speak on the normal schedule. All of
So
those.
yeah, a couple things that I remember, and now as you're talking, brings back to our earlier discussions. One is constipation, right? So that is a major problem. It's not that every child with autism has constipation; many do, and it often contributes to behavioral problems. So and that is one of the key elements that we're always looking to address is how is the bowel function. We'll talk about some other things that come up just with dysbiosis. The other thing that is interesting that you mentioned is that whenever he did run a fever, many or some of his autistic characteristics improved. And it's often been sort of debated, we're trying to figure out what exactly is happening, right? So is the fever activating enzyme activity, right? So we know that enzyme activity will increase in many cases with increases of temperature. So we get better conversion. So perhaps we're getting maybe better sequencing within the brain and nervous system between different components of the brain or neuron to neuron. The other thing with fever is it helping to fight some type of infection, right? Well, if you have an infection, well, one of the things the immune system does is it increases inflammatory reactions to try to bring immune cells to an area that is under stress or in a battle, so to speak. And the other thing I remember about the discussion of fever is perhaps what's happening is we're getting better communication between nerve cells in the brain, primarily either through improvement in methylation status or perhaps just functionality of a nerve cell. So as far as I know, it's never been absolutely 100% proven in what the one mechanism, there's probably multiple mechanisms. And my impression of Matthew, and you can tell me if I'm wrong, but he's one of those kids, and I've seen, many, many kids over the years, they don't all present this way, but it's almost like you'd almost prefer him to be in a state of fever because he was more connected. And so it's interesting. I mean, that was one of his key elements. And we know that with repeated vaccinations in many individuals, it's just a repeat antigenic load against the immune system that just ramps up and ramps up and ramps up, and you tend to drive more inflammation. So that's great information. So at that point, right, he's sensory dysregulated, he's losing eye contact, he's becoming disconnected. Where did you go from there?
So that's an interesting question. It was actually someone shared a Great Plains Lab webinar back in the day, back when it was Great Plains Lab. And you were the one speaking, and you were talking about yeast overgrowth. And you were talking about the giggling in the middle of the night, the silly, goofy, giddy behavior. And so many, you might have also been talking about viral issues in autism. There were so many points where I got goosebumps, the light bulb went on, and I said, this is what's going on with my son. All of what he's talking about is exactly what we're dealing with. I had chickenpox twice. My mother-in-law had chickenpox twice. My father-in-law died from herpes encephalitis. So I knew we had viral issues just historically. And I think I really want to make it clear that while vaccines were an issue for my son, I don't think that was the only issue for my son. I don't want to get into, any sort of black and white discussion. I feel like my son's autism was a cumulative effect. I was 30 when I got pregnant, so I was a, relatively older mom. I was super toxic. I had my own mitochondrial issues, which I know influenced his issues. I have had silver amalgams. I could go down the list. And we ate a very standard American diet. He probably got a ton of glyphosate. He was, I had low cholesterol. I couldn't breastfeed easily. There were so many factors. But the end of the day, when I'm talking about this story with Matthew, it's not one trigger. And it also is not purely genetic, because if his issues were purely genetic, we wouldn't have been able to make the progress that we made in this journey. And we probably wouldn't be having the same conversation sitting here. So I don't want to detract from this message and get people hung up on one thing. But I knew that my child had these issues going on. I heard you speaking about all of the things that can contribute. And, I had this little toddler at this point who had this super bloated belly. He looked like he was pregnant. He craved wheat and dairy. He would rather drink sippy cups of milk than actually eat food. He was addicted to graham crackers. He couldn't tolerate certain food textures. I had to puree his food, like meat and rice and vegetables. I had to puree it so that it was like a baby food texture, like a chunky baby food. He had all of these different issues. And when we finally got him assessed from an OT perspective, he was at a 9-month developmental age. So here he was in this toddler's body, but really with a 9-month-old's ability and, expressive language and, all of the different elements that they monitor in terms of normal childhood development. He was so, so far behind.
So, and it's a good point, Terri, and I appreciate you bringing that up, that it's not just one thing in all cases. We can have multiple triggers that tend to impact these kids. And clearly in Matthew's case, it was multiple things for sure. One thing I did wanted to ask, though, was you mentioned about his food addiction, if you will, to dairy and graham crackers and wheat. Was that something that you saw change over time? Meaning maybe when he was early, I realize he got a first kind of harsh reaction to this 4-month shot. So it wasn't like he was eating salads, or, a high vegetable diet. But I have seen situations, and I don't remember with Matthew, but I have seen situations where kids actually have a fairly balanced diet and then they regress, year and a half, year and a half or so. And then they become highly fixated on gluten and dairy foods. And I wasn't sure if that was the case with Matthew. Maybe the lines are a bit blurred with him, but there's some potential reasons why that happens. I'm just curious if that was a pattern you saw with him.
Well, it was interesting. I ended up learning about the impact of low cholesterol, through Dr. Shah, and realized that I've had low cholesterol my entire life. Like I would go in and get it tested and it would be 112. So, looking back, I didn't go into labor on my own. I had to be induced. He had very high, I was kind of pumped full of Pitocin for over 20 hours. You and I explored Respinate therapy as a result of, his birth experience. For that reason, when he was born via C-section, breastfeeding and my milk supply was really challenging. And so I had to supplement him. I would nurse and pump and nurse and pump. And that was our reality for a good 9 months. And so we would try formulas with him and they would upset his stomach. And of course, it's hard to tease out now, right? What was him screaming because of, brain inflammation? What was him screaming because of GI issues? They had to switch him to a soy formula. That was even worse for him. And it wasn't until years later that I understood kind of what that mechanism was. But he was always pretty addicted to wheat and dairy, but especially milk. And it was actually our first OT who was very well versed in, these dietary things with autism, and especially things like additives, MSG, dyes, things like that. So by the time we found you, we had already begun to dip our toe into gluten-free, dairy-free, soy-free. and had already started to see really great benefits. We needed to go deeper in that, but that was a really great starting place for us.
So one of the things about that, Terri, as you know now, these quick regressions that you sometimes see with some kids, or maybe, and not all of them, of course, but this high intensity drive to gluten, dairy, and then you mentioned soy. And so there can be immune system reactions that occur because of that. So we can just get IgG reactivity that drives inflammation. The other component is what's called the peptide effect, right? So the small protein sequences in these foods will take on an opiate type of characteristic, and they can then interact with different receptors in the brain or nervous system that trigger that type of addictive behavior and disrupt the sensory system, et cetera. And it's thought that in certain individuals, again, that because a vaccine load, it could be an infection too, whatever is triggering it, triggering some type of immune reaction, you can get cross antibody reactivity within the immune system. And there are certain enzymes in our digestive system. One specifically is called dipeptidylpeptidase 4, that when that enzyme system becomes dysfunctional, it increases the risk of absorption of these peptides. So sometimes I've seen it happen very quickly, and then others is like Matthew, where it was just something that just sort of evolved over time. So very interesting, and I think important for people to understand.
And one thing about the peptide issue is that we saw that we didn't know what we were seeing. He had a very blunted pain response. And I believe it was because of that peptide, reaction. I'm sure we know he had leaky gut. We did the testing, and those peptides get into the bloodstream and can fit into those opiate receptors. He would come in and have a scratch on him from playing outside that was bleeding, and he didn't even know it was there. He did not sense pain in an appropriate way when he was consuming gluten and dairy. Once we pulled that out of his system, and, for anybody listening and hearing us talk about, removing wheat and dairy and thinking, oh gosh, all my kid eats is pizza and, macaroni and cheese and chicken nuggets. I felt that way too. And it was scary and intimidating to think about making these big changes, because I was thinking my child is going to starve. And you got to do it. You got to rip the Band-Aid off. I did it one compound and then the other. So I felt that dairy was the bigger issue for him. So we started with dairy. And then once we got dairy out of his system, then I moved on to the gluten. And nowadays it's so much easier, I think, because there are so many commercial options that are gluten-free, dairy-free. And it was, the first week was heaven. The second week was hell. And there was a little bit of a hurdle to get over, but then he was in very varied ways a different child. And it still is one of those foundational therapies that I will always be grateful for, because it gave us another glimpse of our child and really helped us on the journey. Because let me tell you, doing all of these things, the blood draws, collecting the samples, looking at testing, trying to decipher what it means and how to correlate behaviors, and doing all of these things while managing your household and other children and their school needs and all of these things. It's not for the faint of heart. But when you start making these changes and you begin to see what's possible for your child, that's what keeps you going and allows you to keep moving through all of the stages of your child's journey.
So one of the things that's interesting about his milk, right? Milk greater than gluten, for example. I've seen that too. So both are problematic, but I would say if I had to, put down a percentage, dairy is usually more problematic. And that's not to say that gluten is okay for these kids, right? It's not for many of them. But often it's the dairy that seems to drive much more of the problems. And but both need to be eliminated. Interesting too, go back to his constipation. Not only was his pain response blunted, but we know that these opiates also can lead to constipation. So it's probably causing some sensory dysregulation on his internal recognition of having a bowel movement. Let me ask you, Terri, testing, right? So one of the things that we had done is some different types of testing. We had also done Methyl-B12. And so we can talk about Methyl-B12, we can talk about testing. So, you're implementing the diet, you're making your way through this, and then, the testing comes up. So take us at this point, moving forward, because there's other therapies you've done as well. But what did some of the testing reveal?
So, you give parents options. And I remember, you saying like, here are all the tests that we can run. And obviously, the more data, then the better that hones our next steps. And so it was my mindset like, let's do it all. I want to get as much information about what's going on in his body and how we can optimize things. So we did hair, stool, urine, blood. So we looked at food intolerances. So we did an IgG. We did porphyrin testing. I remember saying, my child's bodily fluids have been to more countries and states than I think I have at this point in time. And, some like looking back, when I talk to parents now, one of the big tests that I really encourage them to do is an organic acids test. And that was one that you and I would run frequently, and we would meet and we would reassess what, we're doing working. Are we making changes? And not just from the lab value point of view, right? It had to be matching up with behavioral things as well. And so that's where I started. I created a log and I would track everything that we were doing so that when we got his food allergy test back and we were making those nutritional changes and avoiding those foods, I could kind of track what his response was. When we would do an organic acids test and we would get a glimpse at what's going on in his gut, what sort of microorganism imbalance is there, markers of mitochondrial issues, nutrient deficiency markers, all of those different things, neurotransmitters, which became so important in terms of helping balance his mood and his brain, especially when we were trying to address his gut dysbiosis, which had such a profound effect on those neurotransmitters. It just became this giant puzzle, right? And if I could wrap my brain around, okay, so when this lab marker, clostridia, for example, is elevated, and Matthew had such high levels of one marker on the oat, the HPHPA, it was like 1600. Reference range is 200. And it had a significant impact on his mood. That was where I would have a child who was very quick to anger. If he got frustrated in even the smallest way, the toy he was playing with was being chucked across the room. He was never an overtly aggressive child, but if he was going to be frustrated, it was likely his clostridia was elevated. And he had both.
Yeah, the organic acid test is a critical test, and it's very important. I've run thousands of them over the years, or people presented them to me for consultation purposes or just to review them. And so it's a critical test. It's a urine test that looks at metabolites of biochemical imbalances as well as bacterial and fungal overgrowth in the digestive tract. And the clostridia is a huge one. I do remember Matthew really struggling with it. And so that was, as I look back, right, it's been many years, that was one of the things that I sort of take away from Matthew's case is this underlying continual, or I shouldn't say continual, but recurrent issue with clostridia. And that we know clostridia is a recurrent type of bacteria. And it makes sense if you go back and just look at his history of all the gut problems and the immune system problems, et cetera. It makes sense. Why wouldn't he have recurrent clostridia? His whole system was sort of primed for that. And then, of course, on top of that is the fungal issues. One of the other things, too, is that I remember with Matthew was his response to Methyl-B12. And so just briefly tell us your recollection of the methyl B12 aspect of his care.
So that was really interesting because as soon as we started doing the methyl B12 shots, we saw an improvement in sleep and expressive language, which are two, really profound pieces in terms of a family, right? Like when you're trying to communicate with your child, them not being able to communicate with you effectively causes all kinds of frustration, which is obviously compounded if there are these underlying, infections in the gut. But being able to have him communicate verbally with us was huge. But the sleep portion of that, and the B12 being a part of that methylation cycle and being able to now produce his own melatonin and sleep with greater regularity, that was absolutely huge for him.
So it's interesting, the methyl B12 and the injection therapy has been around a long time, and it's been profoundly helpful for many individuals. There are other forms. I've had some good success with liposomal methylcobalamin as well. So he was one of those kids that just did extremely well. So again, I kind of look back in time at his particular case, and it was he sort of is emblematic of what I call the four pillars. I many years ago came up with this 4-pillar approach, where to look at just the foundational aspects of autism intervention from a biomedical standpoint is you always have to start with diet, right? So, and that's a moving target to some degree. That in itself is a spectrum, but gluten, casein-free, and then other real food, whole food diet, right? Just trying to improve nutrition and then removing foods that are problematic. So that's fundamental and still is. Next is, well, you could kind of go back and forth between gut function or foundational nutrients. We can talk about just foundational nutrients. And what I mean by that is supplementation. Yes, in an ideal world, we get our nutrients from our food. But we know that these kids like Matthew, who are highly addicted to a certain group of foods, they're not getting a well-rounded diet. So we've got to come in with foundational supplementation to fill in those gaps nutritionally, whether that's essential fats, multivitamin, minerals, et cetera. But that wakes up their body, right? It wakes up their biochemistry. It stimulates mitochondrial activity. It can have an improvement in brain and nervous system function. And then, of course, is the gut issues. And he was sort of classic for that with the constipation, the clostridia, the fungal issues. The organic acid test helps to sort of round that out. And then he also did well with the 4th pillar, which is methylation support. And there's a number of things, as you know, Terri, that fit into the methylation biochemistry picture, but methylcobalamin is one of them. And so Matthew, as I look back, right, and we've had these conversations, he encapsulated all of that. And from a pure fundamental biomedical intervention standpoint. But I know there's other things that you did. And so, as time progressed, right, this wasn't a 2-month or a 2-week, 2-month, or even a 2-year process, right? This was a process that evolved over time. So tell us a little bit more about sort of the evolution of your journey and where you took it from there. What were some other key therapies that Matthew did that really seemed to help?
So we did Respin, which is a therapy to sort of, what would you say, counteract Pitocin exposure and labor and delivery. And I liked the social gains that we got, but they didn't hold. If he wasn't, wearing the little disc on his back, we lost all of the gains. And so then we really dove into homeopathy to try and replicate the healing effects of the Respin, but in a different level. And that was really impactful. And then I felt like, we had done a lot of detox. We did glutathione, we did sauna therapy. We had a sauna in our home. And I felt like we had sort of stalled. And Matthew was 11 years old by this point and considered, recovered, but we still had some social issues and some executive functioning issues that I was still looking to optimize. And so I got approached by a company called Ion Cleanse by AMD, and they were reaching out to an autism organization that I'm a part of. And they wanted to look at what their technology could do for individuals on the autism spectrum. And I was highly skeptical. I saw these people at conferences, these tubs of water, and they turned all of these crazy colors and had all of these different, floating things. And I just thought that is the biggest scam because, you see a lot in the autism community, and not all of it is legitimate. Not all of it is science-based. So I agreed partly because I wanted to kind of debunk this whole thing. And at the time, I was working for New Beginnings, and I was also working for Great Plains Labs at the time, since they were sister companies. And so I thought, well, this is perfect. I have the ability to, get labs on Matthew whenever I want. I can run pre and post, and I can basically show that this does not work. And so I signed up to be a part of this. It was an 120-day study, and we had to start by doing an ATEC. So it is an online autism treatment evaluation checklist. And you can Google that. You can put in, answer all of the questions, and then it spits out a number. And based on the number, that kind of, correlates to the severity of your child's autism. So the higher the number, the more autism symptoms they're exhibiting. So the lower the number, the quote, better, right? So anything under 10 is considered not on the autism spectrum. So when we started that, Matthew was a 25. And like I said, he was mainstreamed. He was still getting a few services like speech and OT. But in terms of his functionality, he was a far cry from the little nonverbal, stimming, non-responsive little 4-year-old. So
by the way, did you have an ATEC score from years prior? I don't remember.
No, but we have CARS. We had all the CARS evaluations, but I don't think we did an ATEC when he was really that young.
So he starts the ion cleanse at a 25.
At a 25. Okay. And so we had just had Christmas, and he had this toy that's like a clear plastic ball, but with almost like a little maze inside of it with a BB. And you have to rotate this ball like 360 degrees to get the ball through the little track. And, it's like a little puzzle. And he had gotten that for Christmas. It was a little bit too, I don't know, over the top, stimulating, whatever. He looked at it, tried to play with it for a moment, and immediately gave it to his younger sister. So now here we are a couple weeks later. We're doing our first cleanse. I'm not expecting a lot, right? Remember, I'm still thinking this is bogus, this is snake oil. And so we do his first cleanse. We're dumping the tub because they had said we can use it on our whole family. So I was getting ready to put my daughter in one. He goes into her room, gets this ball, comes out, comes and sits with us at the dining room table, and is calmly doing this puzzle that had previously been just a little too intense for him. So Eric and I are looking at each other like, okay, it's probably a fluke. Then we get in the car, and he would respond to you, but he wouldn't really initiate conversation. So we're driving around, and I hear him in the back to his sister. He says, "Hey, Emma, do you want to play I Spy?" And that's when Eric and I looked at each other and said, okay, there might be something to this whole foot bath thing. And so we dove in, we continued the whole protocol. We did the 120 days, and his ATEC went from a 25 down to a 3. Wow. And a part of that, he had
4 months, right? 4 months?
4 months.
Yeah.
And, this is the thing, like we had really done a lot. It's not like we were just getting started with interventions, but detox, we had done the GPL talks on him. We definitely had seen certain markers even on the oat related to different things. And, when I dove into what was happening in the tub and the, alternating positive ions and negative ions, and it really made sense to me then. So if the body is filled with toxins, which I know I was already toxic. And, we lived a very standard American lifestyle in those first few years. You have all of these toxins, and they can certainly bind to those receptor sites. Because after we started doing the ion cleanse, the supplement protocols got more effective. It was like those pathways were opened up, and he could actually absorb and utilize things in a deeper way. In fact, his methylmalonic marker on his oat, it wasn't until after we were doing ion cleanse, this was probably for a good few years, it finally stopped showing as needing, B12. And we had been doing B12 injections for a number of years. And so it became this little bit of an understanding of, wow, once we unburden the body, his body is able to assimilate and absorb and utilize all of these nutrients that I was really working hard to push, but they weren't quite hitting the mark because of his underlying toxic burden.
It's interesting, Terri, in thinking about that, just to think of the B12, right? It's relatively straightforward. That may not be the best word, to overcome a deficiency of a certain nutrient for some of them. Okay. And we've got certain nutrients that our body uses biochemically much more robustly than others. So many of the B vitamins, for example, tend to get used in many different areas biochemically, riboflavin, thiamine, B6. B12 has a very unique role biochemically. It really works in just a couple areas biochemically, but those areas are under a high demand. And what I've often found is with the B12 is we weren't necessarily using methylcobalamin, for example, to overcome a methylcobalamin deficiency per se, but what I call a biochemical dependency on a continual supply of it because of, and I knew, other demands on the system that were constantly putting stress on that methylation pathway. And as you mentioned, right, you go through this process of detoxification, you're starting to remove other types of chemical compounds that are either interfering with some of the biochemistry or perhaps themselves increasing detoxification demands, so pulling resources on these types of nutrients. And all of a sudden, over time, you start detoxifying the body, reducing the toxic load. All of a sudden, these things start working better. Or maybe what's really working is just the underlying physiology starts working better. It was already intact and ready to go. It just was compromised. And I've seen that play out, whether it's ion cleanse, whether it's infrared sauna, whether it is, whether it's a metal chelation type of program or glutathione or whatever you're trying to deal with from a toxin standpoint, mycotoxins. Hyperbaric oxygen therapy, we know, has, even though it's not a primary detoxification type of intervention, when you increase oxygen utilization at the cellular level, and particularly the mitochondrial level, well, all of a sudden the liver starts working better. The immune system starts working better. The kidneys start working better. So it has sort of an adjunctive type of effect on that. So very interesting. And I think the whole discussion really, as I look back, is his autism wasn't just triggered by one thing, right? It was a series of things. And his movement out of autism wasn't just done by one thing. It was a process that evolved over time. And it was through implementing these different strategies. And we've had these conversations before. Fundamentally, the things that you did, I know the diet wasn't just one diet and then you dropped it and moved on to the next therapy. It was a continual pursuit of diet. It was a continual pursuit of nutrition. It was a continual pursuit of improving his gut function. It was a continual pursuit of doing other things to support detox and underlying biochemistry. So with regards to, as you look back, when you talk to a parent, or maybe it's a doctor, because you go to conferences and you're coming in contact with practitioners who are getting into this field, again, this wasn't a 2-week, 2-month, or 2-year process, right? And I think there's a narrative out there in some respects that it's sold that, you just do this, that, and the other, and, things will resolve pretty quickly. But you and I know that that's not always the case. And so what do you tell a parent who is first getting a diagnosis with their child of what to expect, and how do you encourage them in this process?
Well, the timing on this is amazing because I just got back from the TACA conference, which is a large conference on the West Coast devoted to supporting families. And this it brings up sort of a tricky topic, if you will. And it came up this weekend, which is why I'm mentioning it. When I started this, it was never because I didn't like my child's autism diagnosis, that I felt any sort of way that my child was diagnosed with autism. It was never about that. And it was never about losing his diagnosis. But when you have a child who is chronically ill, who has constipation, who cannot sleep, who's screaming most of the day and night, to chalk up things like constipation or bloated belly or food allergies as just a part of autism, I think at this point it's actually criminal. And that's what parents are still being told. Here we are. I'm 16 years post-diagnosis. And I just spoke with hundreds of parents over the weekend who have all been told the same thing. Your child has autism. It's a genetic disorder. There's no changing it. There's no improving it. So I look at parents and I say, first of all, let me tell you my story about my son and where he was and where he is now. And it's not easy, but it's doable. And you have to just start putting one foot in front of the other. Get a knowledgeable physician, run some testing, look at bringing in some basic supplementation. Why is that important? What we just talked about. They often are picky eaters. They often have impaired gut issues. They're constipated. They have, gut issues that are making it, even if they had the most perfect diet in the world, which no child does, they're not absorbing it effectively. And our kids oftentimes need higher amounts and or different forms of specific nutrients, especially those critical B vitamins. And so there's always a place to start. And I always say, look at diet, bring in a basic high quality, no chewable is going to cut it, no gummy is going to cut it. You have to get a multivitamin, multimineral that has been specifically formulated for children on the autism spectrum, that doesn't have fillers and all of this junk. Get them some good essential fats for their brain, and then go do some testing. And the testing is going to guide you on what comes next. Is it gut? Is it immune? Is it mold toxicity? Is it a strep infection? So like a PANS or a PANDAS diagnosis. We all lump autism in this one big pot. But there are so many different subsets of the way autism manifests in each child. And it's not about a label. It's not about neurodiversity. I love my son, no matter how his brain works. But I wanted to be able to hear his voice and get a glimpse into his brain. And I couldn't do that when he was bogged down by food, allergies and widespread inflammation and gut dysbiosis. So we're really talking about optimizing our child's health and wellness and maximizing their God-given potential. And so, there were so many times where I'd have parents come up with like that deer in the headlights look. And I would just go over to them and start talking, and they would just burst into tears. And then I'm crying, I'm remembering what it was like to get that diagnosis and to feel very isolated and very confused. So, the great news is there are so many resources. Anyone listening to this podcast right now, you've heard us talk about a handful of amazing therapies that, you got to go and explore. And one of the gifts that you gave me was to make me an educated and empowered parent. And parents really need to take ownership of their child's recovery journey. And they need to be able to go down those rabbit holes and bring ideas to their physicians, like I was able to bring to you over the years, to talk things out and to be collaborative. To your point about there are people out there saying, here's the way for autism recovery. There is no one way, right? There's your child's way, and that's the only way that matters. If you are getting put into a cookie cutter protocol, you need to find another physician.
I completely agree 110%. I've often said, you really kind of took the words right out of my mouth, is I'm always looking at optimizing potential. So I believe everybody can be helped. Not everybody can be cured, not everybody can be recovered, but everybody can be helped to some degree. We know that autism is treatable. There's a lot of help and hope. And again, it's not taking away, as you mentioned, the neurodiversity or the love for a child, whatever. But if you have a child that's sick, it doesn't matter if they're neurotypical or autistic or whatever label they have or diagnosis. They're sick. They don't feel good, right? Why wouldn't we want to try and fix that? I remember a case, and it wasn't actually a case it was a parent that came to me with their son. Now, their son was older. And at one point in this child's development, he had a self-injurious behavior where he would hit himself in the mouth. And this went on for a number of months. And his conventional docs, I don't know who they were, pediatrician, neurologist, whatever, was that, as you mentioned, that's just part of his autism. All autistic individuals hit themselves, or they're self-injurious, or they have behaviors or whatever. And it turned out that this parent, this is before they came to see me, had gone to a practitioner and said, "When's the last time your son's been to a dentist?" They took their son to a dentist. He had a cavity. He was hitting himself in the mouth because he couldn't tell his parents that his mouth hurt. So he was agitated, hitting himself. And he had at the time, he had a big bruise and blister. So no one bothered to check. It was assumed his problems were because of autism. We could do an entire show on that. So I think that's great insight, Terri, and fantastic information. Let's talk real briefly as we wrap this up. And then I want to talk a little bit about what you're doing too, just professionally. As a parent, right? This is not, it's certainly focused on the child, okay? But it's the parent or parents, it's mom and dad, or whoever, right? The caregivers. What are some suggestions that you can give as a parent who's been through this in how to take care of yourself? Because it's the long haul, right? It's not 2 weeks, 2 months, or even 2 years in many cases. It's a long process. And I've seen many parents get burned out. I've seen many parents get ill because of stress. And so just a few thoughts. What are some recommendations you'd give?
This is such a great question, because if you remember when I first walked into your doors, I was about 60 pounds heavier. If I hadn't changed my own ways along this 15, 16-year journey, I would likely be diabetic and have metabolic syndrome at this point. And I will say, looking back, it's easier for me to say this. I created a guide that's all about mindset for special needs parents because my mindset was so horrible. I'm going to be real honest. And I didn't have the tools in my toolbox to cope with the level of stress, with the amount of, sleep deprivation I was facing. I am not always proud of the way I responded in those early days. And I just remember thinking, gosh, what could have made my life easier? Now I know, having had a practice and worked with clients in terms of mindset, meditation, strategies like tapping, breathing exercises. And now there are so many apps that you can have on your phone. I put together a guide because I wanted to make it really easy for autism moms. I remember you're in the school pickup line, waiting to pick up your preschooler. You're in a therapy clinic waiting room. What can you do? This isn't go on a 10-day, Buddhist retreat in Nepal. This is what can you do in between the 2 seconds that your child is being occupied before they lose interest and are, going off in another direction. So tapping, meditation. And then lastly, and I'm sad that I put myself last, is supporting yourself. Realize that whatever testing you're doing for your child and you're seeing mitochondrial issues or adrenal markers, chances are that apple didn't fall too far from the tree. And the nutrients that Matthew needed, I also desperately needed. Now, I get it. You're trying to fund doctor's appointments and supplements and special diets. So, bringing in some adrenal support, making sure your diet is on point, not stress eating, right? Like understanding all of these elements that you're trying to help for your child, you can benefit from as well. And I know it's hard, when you have little ones, but there are things you can do. And it is critical that we take care of ourselves.
So where's that? Is that guide something that people have access to?
Absolutely. I will give you the link. And if you'd like, you can put it in the show notes.
Sounds good. So what is happening with you professionally these days?
So, a number of years ago, after working with you so closely and being so motivated by what we were seeing in Matthew, I went back to school and I got a doctorate in traditional naturopathy, and I opened a wellness coaching practice. Unfortunately, we ended up having to close our doors when COVID, kept us shut for a period of time. I still work for New Beginnings. It's been 14 years, and I serve as their director of marketing and occasionally take a one-on-one coaching client. Usually my circle is very small in terms of, what I have time for, and really help people navigate dietary changes. One of my passions became detox, and we actually offered the Ion Cleanse detox in our practice when we had those doors open. So sometimes I have a few local people still come to me and get some cleansing done. And really, it's just helping as many families as I can out there. I also support a very dear friend, Julie Matthews. She's the leading nutritionist in the autism space, and I help her group program for parents. And so I get to do her live Q&A calls with parents and answer questions. And so I have my fingers in a lot of different pies these days.
And Julie Matthews is fantastic. I mean, she's always been my go-to, in years past from a nutritional standpoint, and just helping with diets, and her program is fantastic. New Beginnings, real quickly, with Lori Knowles. I actually interviewed Lori for an earlier podcast edition. For people who aren't familiar with New Beginnings, who are they? What do they do?
They were started over 20 years ago by Dr. William Shaw and Lori Knowles Jimenez, who you've had on. And they were really Dr. Shaw started the Great Plains Laboratory, now Mosaic Diagnostic. And really it was an answer to, okay, so these autism families are seeing these markers that are out of reference range. Now, what do they do about it? Where can they go for trusted, high quality supplements? And that's really how New Beginnings Nutritionals was born. But over the last 20 years, the product line has expanded exponentially and really doesn't just deal with supports for individuals with autism. It really runs the spectrum of mitochondrial support and detox support and just overall health and wellness. And so that we put on educational webinars every month. Lori and I just did a webinar all about our sons' journeys and their autism recoveries, and really just educating families and individuals to how to use supplements successfully alongside of working with qualified physicians in terms of optimizing health and wellness for autism and beyond.
It's interesting, Terri, Lori's journey with her son Daniel is similar, but there's some differences, in how they presented, right? With how Matthew presented and then how Daniel presented. Similar interventions to some degree. Although I think she did certain things slightly different, as far as some of the detoxification remedies and whatnot. But still, the general concept was still there. Again, it was a process that evolved over time. So any final comments, any final things you want to mention, whether it's a parent listening or a practitioner listening to this, just some words of advice or things coming from a veteran such as yourself who's been in the trenches of this now for many years?
Well, as I look at my son who just turned 20, I had him working a conference, a physician conference a couple months ago. That's where we saw you in person last, which was great. It amazes me where he is today. He is such a kind, caring, loving young man, and he has aspirations to be a writer. And when I look at where he started in this journey, my biggest thing for both parents and practitioners is don't let anyone dictate how far a child with autism can go. And parents, if you are working with somebody, I don't care who it is, teacher, therapist, anybody, you have to keep people around you that see your child in their highest form. If you have somebody who is a naysayer, if you have somebody who doesn't see the potential in your child, you need to get rid of them. Honestly, you have to keep your mindset on where you want to go, because our kids are so intuitive and they pick up the intention and all of our feelings. And it's really critical that we keep visualizing our kids on their path, the healthiest that they can be. And it's really not up to anybody to limit where they can go. And for practitioners, really look at these stories, because the impact that you have on your patients is profound. And being able to empower these parents to take ownership alongside you in this journey makes it way more effective to work with an empowered parent. So, there's so many things that can be done for individuals with autism. You just have to address the unique challenges of that individual.
Great advice, Terri. And I'd say the one thing I was thinking of is just don't pay any attention to naysayers. As we know, they don't know what they're talking about, particularly when it comes to this area. So, hey, Terri, thank you so much for joining me on this podcast. It's great information. It's great to see you again.
You too. Thank you so much.
You've been listening to the Functional Medicine Doc Talk podcast with Dr. Kurt Wohler. For more information about this podcast, go to functionalmedicinedoctalk.com.